The sole hospital in this rural community was in serious trouble. There was just one major provider of medical liability insurance in the state, and that company had just left. The only alternative meant a tenfold increase in costs, effectively making coverage unattainable. Without insurance, the hospital would have to close its doors. Community residents would face a 150-mile journey to the nearest healthcare provider. Seeking a path through the crisis, the hospital turned to Milliman. Immediately, Milliman Consultants conducted an analysis of the hospital's insurance needs. A review of their insurance program and a retention study were conducted, and an ideal solution emerged: a captive insurance program. Milliman Consultants then conducted a feasibility study and recommended a location in which to domicile the captive. Ultimately, the hospital elected to form a pure captive, which is a wholly owned subsidiary of the hospital. Here's how the hospital's pure captive works. In the first step, the captive is capitalized by the hospital. The newly formed captive then sells the hospital an insurance policy, in this case, medical liability coverage for the year. Premiums flow from the hospital to the captive, and the captive pays claims as they're settled. Along with affordable insurance coverage and the ability to purchase reinsurance, the captive provides two additional advantages. First, the captive pays dividends back to the hospital. Second, premiums are invested in an asset portfolio, generating investment income. Milliman Consultants led the hospital through the entire process. They established the initial capitalization, determined the appropriate premiums, recommended the proper amount of loss reserve to set aside, and the appropriate level of reinsurance, and helped the hospital navigate the complex regulatory process. The hospital gained many benefits. The captive minimized insurance costs, including capturing underwriting profit, and stabilized prices. The hospital also improved its cash flow through retained premiums, tax benefits, and investment income. Finally, establishing a captive enabled the hospital to manage its risk more effectively through claims control and access to the reinsurance market. Captive insurance programs can provide significant benefits to many types of business. In the case of this rural hospital, a captive insurance program helped ensure the survival of a community's only local healthcare option. Milliman Insights made the difference.